It's a very scary word.
Cancer. Specifically for Gail Wilson, uterine cancer, 2 words she never wanted to hear from her doctor.
Mama, you're going to do this.
But from her daughter, words of encouragement that led to hours of research into a new procedure.
The doctor just told us about them and said that he had never really had any work with them.
We're talking about cooling caps, an option for patients undergoing chemotherapy to help slow down or stop hair loss.
This is a big deal for women.
St. Bernard's Dr. Mazen Khalil knows that a cancer diagnosis adds stress to every level of a patient's life: physical, emotional, financial.
Our goal is not to only diagnose and treat, but also our goal is to be able to help our patient in every step of the way.
Which is the drive behind St. Bernard's year-long mission to bring a scalp cooling system to their cancer center. And seeing Gail's success with hers,
I was very pleased to say that, yes, I've lost hair, but I never lost all of my hair.
Only strengthens their resolve.
The system we use actually is the best available worldwide.
The Paxman Scalp Cooling System, proven in a clinical trial to decrease hair loss during chemotherapy by 50 to 60%.
Now I'm already having patients ask me to delay their treatment until this scalp cooling system is available.
However, not every cancer patient is considered a good candidate. So far, clinical trials have only proven successful with breast cancer patients undergoing chemotherapy treatment with curative intentions.
If there is a clinical trial it will show that there is benefit for other patients, other type of cancer, then this use could expand.
But starting out, St. Bernard's will only offer the cooling caps option to those specific patients.
And that includes both men and women.
Most importantly, free of charge. Now, there are other cooling cap options available out there.
I started doing some research, but it was a really expensive option.
One that Christy Stokes couldn't afford to choose.
That happened on the 4th of July. My hair began to fall out. It was a really, really difficult day.
And it's not only about looks.
It's an extension of my personality. You know, I loved my hair.
It's about privacy and not having to attempt explaining an already difficult situation.
To me, it was important for my great-grandchildren. They don't have to see mommy or grandmother or whomever just without hair.
And it's about hanging on to one more of the very few choices that are in the patient's hands.
It's one more decision that's put back in our court. One more decision that we can make and have a little bit of control.
Christy has done what she can to regain some of that control after chemo robbed her of her once very long hair.
When I put on my wig, I do feel more normal, more like myself, but it's not the same.
No matter, she continues to fight. A fight that many women and men have faced before her, and one that many will face after. But beginning in December at St. Bernard's, a fight that will include one more decision for the patient to make.
The fact that that can be offered as an option, and women can make that choice, and that they can have the possibility of being able to keep their hair, something that's so personal, it'll just strengthen their ability to fight.
A fight Gail Wilson managed to win.
I didn't have the experience of looking in the mirror and never seeing hair.
Hearing 2 words she was waiting for her doctor to say: cancer-free.